These are very stressful times. Most people, myself included, have never lived through a worldwide pandemic. So it's normal and natural to feel fear. We need to learn to embrace our fear, but sometimes fear has a way of overcoming us and taking control of our behavior and making things worse. So ultimately, what we have to do is we have to be okay handling fear and give ourselves permission to experience fear. Those are two very, very important differences. But we're seeing people particularly with mental illness, who are often unable to deal with stress and stressors. And some people are better able to control their stress and their fear than others. Other people are in a state of abject denial. They believe nothing is going on. We have reports of young people celebrating spring break. So we need to be realistic. We need to focus on logic and fact. So that's sort of my biggest overview. I can get into a lot more details with you, Cindy. Yeah, I think that there are a bunch of exercises that are very, very helpful. I myself enjoy visualization exercises where I think about scenes that I think of as beautiful and familiar. Think about Fort Williams Park and other places that I've been. I like to spend time doing what's called deep muscle relaxation, where you tense your muscles and then release them, and you experience the relaxation of the release. I enjoy doing just deep breathing exercises to slow up, because when we're scared and when we're fearful, our breathing accelerates, our heart races. All of those are physical symptoms, normal symptoms, mind you, of fear and panic. So by taking control of our breathing, learning how to breathe deeply and slow it down, we can get some control over the physical symptoms of anxiety. PTSD is probably best avoided by community coming together. We have very limited experience of the effect of non-military trauma on large populations. The last time that we dealt with this was 9/11. At that point in time, I and my family were living in Bangor, Maine. And the way that we dealt with this as a community is we got together in the park. And again, this is going to sound corny and cliche, but everybody, every homeowner, every child, every neighbor got together, we held hands, and we were there for 15 or 20 minutes for each other. And I got to tell you that that is amazingly therapeutic. It brought us together as a community. And when we're a community, that's when we feel a sense of strength. And that's typically when our feelings of fear and inappropriate or disabling panic subside. And then what that led to is it led to, after this kumbaya moment, this therapeutic moment, is it led to a lot of exchanging of telephone numbers and names so that we could check on each other, so that people who hadn't necessarily been close or even knew each other's names suddenly had a way to reach out. And one of the things that we know for sure, that we know for sure, is that loneliness and isolation make everything worse. And in a time of catastrophe and pandemic, that's a catastrophe. We absolutely, as a community, cannot afford isolation and loneliness, and we certainly can't afford divisiveness. Correct. We can't safely get together and do those things. But there are a lot of things that we can do. In my own personal work, I work with a team of people who are scattered throughout the country. My days are spent on teleconferences and videoing, just like you and I are doing right now. And I know that you and I have met before in person, and hopefully both of us will be fine and our staffs will be fine, and we'll get a chance to break bread and have good times together. But I think we have to leverage technology. We have to use a lot of the apps that are now free, FaceTime, Skype, like we're using now. I'm a psychiatrist, and I can tell you that the psychiatric community, we're doctors who are here for mental health. I'm not going to have any break with my patients. I have the ability to see them, and they can see me and talk with them, and they can talk with me over healthcare secure HIPAA technology. That's free, and anybody with a phone, a laptop, an iPad, a tablet can use it. And I would encourage people to stay connected. That's the single most important thing to do. Stay connected to each other, to your family, your friends, elderly parents, elderly relatives. Connection is the thing that destroys hopelessness and helplessness. You can pick up the phone. Now, there's another group of people that we should spend a few minutes talking about, and those are people with severe and persistent mental illness. Think about people with schizophrenia or disorders where they can't tell what's real. They can't tell if what they hear is real or a hallucination, or if what they think is a real thought or some paranoid thought. You can imagine the impact of a pandemic on their thinking. They're afraid. They're not going to necessarily pick up the phone. They may be afraid of picking up the phone. They may view it as contaminated. They may view it as a source of germs. Yet the reality is they need connection. And one of my dark fears and deep fears is we're going to have collapse of the health system. And a part of the healthcare system that simply cannot afford to collapse is the mental health system in Maine. We have a substance use disorder crisis. We have people who are opiate-dependent individuals getting treatment, turning their lives around, entering recovery. We cannot interrupt their treatment. We have to embrace technology. But on the other hand, we have to remember that we have to look out for the health of our workforce to make sure that they're physically healthy and not infected with this terrifying virus, and that they're mentally ill so that they can serve those patients. And we need to, and I must say that the government has been absolutely wonderful in unshackling us so we can use technology, including now the telephone, to make contacts to our patients. I also have to say that mental health agencies and substance abuse agencies in the state of Maine run on a shoestring. These are agencies that don't have any fat, and if they're forced to close their doors, and I don't mean to scare anybody, but it runs the risk of decimating the mental health and substance abuse treatment infrastructure that we've already developed in Maine, and boy, it's a good one. We've had a reduction in the number of opiate deaths so far for the first time. We don't want to lose it. So I'm hoping that those agencies can get the funding that they need to stay open, because my gut, not to go by gut, we want to go by data, but my gut is telling me that there are going to be agency closures, and those agencies are going to have to be made whole, or we're going to have no way of treating the mentally ill people, our neighbors with substance use disorders, and we can't let that happen. Cindy, and maybe this is a good, bigger conversation, but loneliness in America is an epidemic. And to put this into healthcare speak in healthcare terms, let's translate loneliness into other dangerous things. The impact of loneliness on America is the equivalent of smoking 3/4 of a pack of cigarettes a day. That's a lot of health. It costs a lot of money, and it is responsible for a profound amount of American misery. We have to do our best to prevent that. I think that now is the time to check on your neighbors. It's a wonderful time to reach out to people that you disagree with, right? People are not going to have anything better to do. So what better time to reach out with the person that you had that argument with ask if they need some chicken soup, and really begin to forge those connections. Obviously, we live in a politically charged society. It's not my role as a psychiatrist to be political, but it is my role as a doctor to say that we have to do everything that we possibly can to keep ourselves together so that we could work in a coordinated manner to look after our most vulnerable in ourselves, right? I think that that's quite a lot. I hope that that's enough for your audience to absorb. And if there's anything that I can help you with in the future, please let me know. I'd be honored to be a resource for you guys. My pleasure. You too.